Welcome to DCA TV. I'm Victoria, and I'm here today to interview Dr. Mary Lupo, the woman behind the vision of Lupo Center for Aesthetic and General Dermatology since 1984. She is a board-certified dermatologist and a clinical professor of dermatology at Tulane University School of Medicine. Dr. Lupo founded the Mary Lupo Skincare System, an innovative skincare product line for all skin types. She's often quoted in national beauty magazines on various dermatological topics, from acne to aging skin and from skin cancers to fillers and cosmeceuticals. Welcome, Dr. Lupo, and thank you for being on the show.
It's my pleasure.
Now, congratulations, Dr. Lupo. You are the first recipient of the New Orleans Doctor's Choice Awards in Dermatology in 2014. What are your thoughts about being the first winner?
Well, it's always nice to be the first. I think what's more important is that you're chosen by your peers around the country, and that's always a very nice thing.
Okay. How significant or how essential is it for dermatologists to belong to a professional association or organizations as they continue to practice?
Well, being a member of organizations such as the American Academy of Dermatology or the American Society for Dermatologic Surgery means that it gives you access to your peers, that you can go to meetings and learn more about the advances in your practice and in your specialty.
Okay. Now, you have received great reviews from other leaders in the medical industry. What would you like to tell them?
Well, thank you. I think that a lot of the people who reviewed me are people that are equally impressive, and we know each other because we've shared the podium over the years at various meetings, or we've been on clinical studies together for FDA approval of new materials and drugs, or they have actually spent time in my office in the form of doing mentorships or preceptorships, which I do quite a bit of through the WDS and the ASDS.
Okay. And is there anything you'd actually like to tell them?
Well, that it motivates me to continue to do more and better things, and it always keeps you engaged in your profession when you interact with other people who keep best.
Fantastic. Well, I understand that you also teach medical students, that you were just saying that, and other training practitioners while also participating in clinical research on new products in your field. How do you think these dual roles help set you apart?
Well, I spend quite a bit of time training residents, and through a CME meeting called the Cosmetic Boot Camp, of which I'm a founding co-director, I've had the opportunity to literally hundreds of other physicians around the country and around the world. I really feel that when you teach, it forces you to stay at the very top of your game, and it keeps me stimulated. It allows me to do the very best for my own patients as I'm training the next generation.
Fantastic. Now, how did you get into the field of dermatology to begin with?
I was interested in dermatology since I was a 16-year-old. I had to go to a dermatologist, and I thought that it was a very intriguing field. Once I got into medical school, what drew me to dermatology was the variety. I'm a person that I really need variety. I love the fact that I can take care of all age groups in dermatology, that my practice for years was a blended practice of medical and aesthetic, and although I'm mostly aesthetic and cosmetic these days, I still quite a bit with acne, rosacea, dyspigmentation problems. So it's variety that I crave, and constant stimulation. And dermatology has been so ever evolving, and we really have been at the forefront of non-surgical skin rejuvenation. And since 1983, as a chief resident, I've been very much a part of that transition and evolution.
Fantastic. Was there an actual specific moment, or was it when you were 16 and went to the dermatologist?
Well, when I decided to go and really take the branch of cosmetic dermatology was really in 1983. I was a chief resident at Tulane, and we were learning how to do dermabrasion. Dermabrasion is a very aggressive technique to resurface severely acne-scarred skin. And I learned at a meeting about a newly FDA-approved product called Xyrem and Zyplast, which were the very first FDA-approved dermal fillers.
Okay.
And they were injected underneath the skin to improve the contours. And I went to the acting chief at dermatology at Tulane, Dr. Larry Milliken, and I said, you know, Dr. Milliken, I really want to learn how to do these injectable fillers while I'm a resident, because I really think this is going to be a trend, and I want Tulane to be at the forefront. So I actually started a clinic, I was chief resident, where we did Zyderm and Zyplast, we did light chemical peels, and we were doing sclerotherapy for leg vein injections. So we really began to do these non-invasive procedures very early on. And then when I finished in 1984, I continued on for 30 years, I was the director of that clinic for the residents. And then in 2005, Dr. Kara and Dr. Vic Narkar and I started the Cosmetic Boot Camp. And we basically brought the tradition of injectable teachings, because by that time we had a number of other fillers, and we had neuromodulation with Botox products, and we had very, very interesting lasers. So we began to have more tools that we could really make meaningful differences in people's appearance non-surgically. So we started Cosmetic Boot Camp in order to advocate for non-surgical rejuvenation and begin to teach another generation of younger doctors the techniques.
Okay. Well, I do love your commitment to continuing education. What other postgraduate programs do you work with, and what advice do you have for other dermatologists with regard to continuing education?
Well, continuing medical education is essential in order to keep you at the forefront of your profession. So that is, it doesn't matter what your specialty is, you must do continuing medical education because medicine is ever evolving.
Okay.
Regarding my other activities, besides training the residents at Tulane, I actually have preceptorships at my office and accept residents that apply for preceptor grants from the American Society for Dermatologic Surgery, as well as the Women's Dermatological Society. And through notoriety, I've actually had practicing physicians from as far away as India come and spend time in my office to learn my non-surgical injection techniques.
Okay. I guess right off of that, what skin conditions are commonly treated in your office?
Well, the vast majority of my patients come to me for injections, for dermal fillers, for global volumization, for improvement in skin texture, for improvement of dynamic wrinkles. And I use a combination of injectable materials and laser and energy devices such as radio frequency and ultrasound devices, as well as lasers and pulse light devices, in order to make meaningful differences, but natural differences in how people look. My goal is always to make a patient feel better about how they look, to give them a sense of empowerment and to make them feel active. I also want my patients to feel that when they look in the mirror that they just look like a better version of themselves. I don't ever want a patient to look weird or different. So I'm a poster child, I think, for understanding that the normal average woman just wants to look like the very best version that she can possibly look. And that's what I try to deliver to my patients every day.
Well, you are also a master at testing the latest aesthetic procedures in skin rejuvenation. What skills do you think have been important to your success?
I think a curiosity about things has been very important to my success. I think a constant desire to learn, a constant desire to get better every day, and I am never a person who would be comfortable resting on her laurels. I feel like every day is an opportunity for me to make a difference in a patient's life, to make them feel better about themselves and how they look and feel about themselves and the face that they project to the world. So it's very gratifying to have patients come back and tell me how happy I made them when they went to that special event and they were glowing and looked good and they feel better about themselves.
Okay. Well, running a highly successful and respected dermatology practice such as yours must take considerable leadership skills. What three leadership techniques do you think are most important in a medical practice?
I think the number one thing is to listen. I think you must listen to your patients and you must listen to your employees. And communication is key. I think that without communication, you can't really deliver a good job for your patients, and the office in general will fall short of what you can achieve if there's not good communication between the employees. I'd say listening is very, very important. The second thing that I think is important is curiosity, a desire to constantly learn, to constantly advance. And I think the third thing is to have an element of respect for your patients, for your employees, and that they know that you have an open door, that if a patient comes in, that they know that I'm going to listen to their needs, I'm going to hopefully adequately communicate what I see as how to achieve their goals. So it's a conversation. It's not a one-way directive of me telling the patients what to do. I like to get feedback from my patients, and I like to be able to have an open dialogue with my patients and with my employees.
Okay, and the third thing?
Oh, that was everything. That was
Oh,
listening.
that was everything.
Yeah, that was curiosity, and that was respect. Three things. If you need more, I'll try to come up with more, but those were three.
Oh, I apologize. Well, tell us about a time when you had to face a challenge as a leader.
Well, I think the challenge you face as a leader is with your employees. Sometimes there's dissent in an office, there's personality differences, and I think the most important thing that I do when I'm challenged is it's a challenge with managing employees. If all I had to do was take care of patients, my life would be very easy. I think the challenge is more the business and the administration of medicine. And unfortunately, in order to deliver excellent care to my patients, I need a support staff. And sometimes the biggest challenge is making sure that everyone's on the same page at the same time.
Understood. Well, do you think collaboration and networking among physicians through services and programs such as Doctor's Choice Awards play an important role in the success of the modern medical professional?
Absolutely. I think that anytime doctors can communicate with each other, whether it be sharing trends and sharing thoughts and new innovation, or sharing strategies on how to deliver more efficient and excellent care to their patients, or how to manage a practice. I think all of these things we all learn from each other. And again, it's a constant, being a doctor these days is almost like being in a chess match, and you do what you think is right, but then life comes at you with a move, and sometimes you're kind of surprised and you need to make an adjustment. And so you have to be very nimble. You have to have the ability to see a change, hopefully ahead of when most people see a trend. I've considered myself very, very lucky, and am very proud of the fact that I saw the trend of non-surgical rejuvenation back in 1983. It really didn't even become mainstream for another 20 years or so. So I'm very proud of that innovative directive that I took with my practice.
Okay. Well, those are all the questions I have for you today. Again, thank you, Dr. Lupo, for being on the show today.
Thank you. It was my pleasure.